The next question is for Colonel Pooran, and it is, what is an EUA and how is that different than an approved vaccine?
So an EUA is an emergency use authorization, and it's a mechanism that the federal government and the FDA use to allow us to be able to prescribe and administer drugs or vaccines that otherwise have not gone through the full approval process. And in short, there are two aspects of any drug or vaccine that's used. One is safety, and the other is efficacy. And so in an EUA, what the government is saying is that we know this to be safe. Now, every medication, every drug we use has a certain set of side effects. Even when we give people water, we can see side effects, right? So this is not to say that it's zero or completely clear of any side effects or negative impacts, but it's to say that it's relatively safe, and it's safe to the point where it's acceptable, comparable to all the other vaccines that we use. The issue then becomes for an EUA is efficacy. Now, we've done a phase 1, a phase 2. That data was available, a significant portion of the phase 3 data, which is a larger subset of patients. So phase 1 is they just injected a bunch of people, 15 people. Do they live? Do they die? Okay, great. Let's go to phase 2. It's several thousand people. Now we want thousand people and start looking for. So in all of those, both the vaccines that have been approved through the EUA so far in the United States have been both efficacious and safe. So when you get a drug under an EAU, you can rest assured that there's been no skimping on the safety. There may be questions about some minor side effects that were not picked up in the smaller subset population. So maybe the 1,000 or 1 in a million things that may happen, which are extreme. But that being said, an EAU is a really effective mechanism to get these drugs out there quickly. And these vaccines are going to be safe. And what I will tell you is that although this is a novel form of a vaccine, you have to understand that on a given year, every single one of us gets infected with mRNA viruses several dozens of times. So the mechanism by which the mRNA enters the body, replicates, that happens to us naturally when coronaviruses and other viruses infect us. So the drug companies are simply using an existing mechanism within the body and using it to put a small portion of the virus in there to create an immune response. This is actually a very ingenious way of doing it. And this technology has been around for over a decade. It's been used in other vaccines. So the technology isn't new either. It's just simply the combination of COVID-19, unique mRNA, in this delivery mechanism to get us the vaccine that we need.
Perfect. Thank you very much for your answer, sir.